Welcome to the Morehouse School of Medicine Online Education and Expanded Programs podcast. We are so excited to have you join us. Please listen as we promote health equity and focus on improving the health and well-being of individuals and communities. Our goal is to increase diversity throughout the healthcare profession and scientific workforce. Make sure to follow us on all social media platforms and enjoy the show. Welcome to the Online Education and Expanded Programs podcast, also known as the OEEP podcast of Morehouse School of Medicine. I am your host, Blake Crosby, and today we have the honor and privilege of interviewing Dr. Luckson of the Oncology Center of the FDA. They have a phenomenal program that they kick off every year called the Black Family Cancer Awareness Week. And so we get the opportunity to sit down and speak with him and just learn more about the awareness that we need to know, and being an HBCU that works specifically in the healthcare industry and the healthcare field and health education. It's important for all of us to just have this knowledge, have this information, so we're all informed and addressing some of the huge health disparities within our community. So thank you so much for being with us today. Welcome. How you doing?
I'm well, thank you.
Fantastic. And so why don't you just tell us a little bit about yourself and your role, your position, and kind of how you came to be a part of the Black Family Cancer Awareness Week.
Sure. Thank you again. Before I start, I just want to take a moment to say thank you for the invitation and this lovely opportunity. My name is Luckson Mathieu, and I'm a thoracic oncologist and senior reviewer within the Division of Thoracic and Head and Neck Cancers here at the FDA. Some brief background information about myself is that I received a medical degree from Meharry Medical College, completed my residency training in internal medicine at the University of Cincinnati, then fellowship in medical oncology at Johns Hopkins. Here at the FDA, I've been part of various studies and clinical trials evaluating cancer drug products across all stages of clinical development. I have been fortunate to play a significant role in reviewing and approving several targeted therapies for patients diagnosed with lung cancer. I also serve as a medical oncologist within the Oncology Center of Excellence, known as the OCE, project community, which aims to help patients and consumers learn more about cancer treatment, and participation in clinical trials.
Okay, phenomenal. Okay, so why don't you tell us, what is Black Family Cancer Awareness?
Sure. So the FDA OCE began its National Black Family Cancer Awareness Initiative in 2021, coinciding with the 50th anniversary of the National Cancer Act and the signing of the Presidential Executive Order 13985. So the purpose of the Black Family Cancer Awareness Week is to increase cancer awareness in one of the most vulnerable segments of the United States population. And we're going to do that with the week-long social media campaign, which will take place from June 15 through June 21st.
Okay.
While formal national organization involvement is welcome, the National Black Family Cancer Awareness Week aims to marshal community-based stakeholders to increase cancer awareness and to build knowledge surrounding cancer clinical trial participation, as well as minority population donation to National Genetic Database for Cancer Research. So at the project community, it will serve as the hub of the social media campaign for the National Black Family Cancer Awareness Week via the hashtag BlackFamCan. I'll say that again, hashtag BlackFamCan. Our intent is to enlist and encourage a wide array of public and private community-focused engagement entities, organizations, families throughout the United States to support the effort to increase cancer awareness and also clinical trial participation. With the common and concerted mission, organizers are urged to focus their supportive endeavors and activities to occur during the National Black Family Cancer Awareness Week, which is on June 15th through June 21st.
Okay. And so what are some of the health disparities that you've seen in communities of color regarding cancer?
Yes, before providing an answer, I would like to first define cancer health disparities. So, the National Cancer Institute, the NCI, defines cancer health disparity as adverse differences that exist among certain population groups in cancer measures such as number of new cases, the number of deaths, cancer related health complications, or even quality of life after cancer treatment. Black and African Americans have the higher rates, actually highest rates of acquiring and dying from cancer compared to members of any other race. Black and African Americans have the highest mortality rate of any racial and ethnic group for all cancers combined, and for many of the most common types of cancers, including breast, lung, prostate, and colorectal cancer. Furthermore, despite having similar rates of breast cancer, African American women are more likely than white women to die of this disease. African American men have prostate cancer death rates more than double than men of any other racial groups. Unfortunately, my description is just a brief depiction of an alarming and expansive reality of disparity that exists.
Wow. Wow. And do you can you just share some light on what the reasons for these disparities might be? Like, why is it such a huge shift, this huge gap between our community and other communities?
Yeah, so research has identified and described many complex and interrelated factors contributing to the existing health disparities for Black and African Americans. Primarily, structural, economic, and social environmental inequities that are rooted in racism and discrimination, as well as genetic and hereditary factors that may be influenced by the environment, have all contributed to this persistent cancer disparity crisis. Research also suggests that racial cancer disparities are driven by a combination of inequities in health coverage and access to care. Beyond health coverage and access to care, discrimination and biases within the healthcare system, coupled with culturally insensitive interactions, all contribute to cancer disparities. Despite significant investment and improvement in cancer outcomes and treatment over time, unfortunately, cancer health disparities have remained and persisted.
Wow. And so, what are some things that we can do to spread awareness, to support Black Fam Can, um, just as just any person listening to this podcast?
Yeah, so Martin Luther King once said, "Science gives man knowledge, which is power." On our National Black Family Cancer Awareness website, we have our title as Cancer Awareness Equals Empowerment. Spreading cancer awareness within the community is critical to empowering individuals as we try to address head on this cancer disparity. One simple start to spreading cancer awareness is by going to our FDA National Black Cancer Awareness Week website. On the website, it has all the information you need to share with others regarding the week themes and engagement activities that will take place. Each day during the week of June 15th, we will have a specific theme to focus on regarding cancer awareness. You are also able to share your engagement with using the hashtag BlackFamCan. We also will have a free public virtual discussion on June 15th at 2:30 p.m., where we will invite different stakeholders to come discuss this matter much more in details. Lastly, we also will have a social media toolkit that contains the National Black Family Cancer Awareness Week graphics, YouTube videos, and also new customizable selfie frames for social media, all designed to help your community promote participation in the National Black Family Cancer Awareness Week. The key is making these crucial conversation community-based, meaningful, informative, effective, and also enjoyable.
Okay. And so, we know that there are hundreds of not, I'm not sure if maybe thousands, but hundreds, at least hundreds of different kinds of cancer. And we don't want to live in fear. We don't want to be fearful. We also want to be proactive, and we want to be mindful of the possibility, that this is an experience that a lot of people of color have had, whether it be people we know, or some of us listening have survived or are currently battling cancer, and or people who have transitioned, who are our relatives or who are no longer with us. So what are some preventative tools that people can use, that people can practice to be stay on the healthier side of things?
That's a great question. I would say first, second, and third, start talking to your primary care physician about cancer prevention. It's a great way to start. I would also add that if you don't have a primary care physician, I recommend that you go online and search nccn.org or cdc.gov, or you can do a Google search and type in American Cancer Society. And also, the FDA has great online resources to obtain more information about cancer screening. Earlier this year, the Department of the Health and Human Services announced a program called the Accelerating Cancer Screening Program. The program goal is to accelerate access to cancer screening as part of the Cancer Moonshot Initiative. I would encourage everyone to go online and consider the role a local HRSA supported healthcare center can play in the process of getting screened for cancer.
Okay, fantastic. And so, what are some things that we can tell our students? With Morehouse School of Medicine, it's one of its main focuses health equity, in empowering our community. And so, what are some things that our students can do to promote health equity in the larger community?
So first of all, you guys are doing a lot. This podcast in itself is huge and critical. So again, I'm so grateful to be part of this podcast here today. One thing that I would say is that all too often families don't know their own cancer history. Some find it too difficult to talk about, especially with older generations who may have associated a stigma with cancer diagnosis or who didn't tell to avoid being perceived as a burden to others. The National Black Family Cancer Awareness Week campaign tagline is engaging the generations. Engaging the generations is one of the key aspects of personal or familial cancer awareness and understanding risk, mapping out, preventative strategies, and pursuing cancer screening. I'm encouraging all students at Morehouse and all students throughout the United States to engage the generation. Talk to your family, talk to your friends, talk to your neighbors about the risks that's involved with cancer, and spread the importance of being mindful of those risks and what mitigation, what steps can you take to decrease the chances or the odds of you getting cancer. In addition, go online, participate via social media through our website. Again, like I mentioned, we have a lot of information already pre-populated there for you. Please engage the website and spread the word as much as possible about our National Black Family Cancer Awareness Week that's coming up very soon, June 15th through June 21st.
Well, thank you so much for being here today. We really do appreciate you taking the time to sit and speak with us. Everyone who is listening, please make sure that you check out, what is the website that people can check out to download the social media kit?
Sure. If you just go online, go on Google and type in FDA National Black Family Cancer Awareness Week, and it's going to pop up and you'll have all the information you need. And probably too much information, but definitely please engage. Also, use the hashtag BlackFamCan on your social media handles. And we really hope that we can get a robust turnout in regards to participation. Thank you
And we will
again for this opportunity, and I really appreciate the time that you have allowed for me to have with your audience today.
absolutely. Thank you. And anyone listening, we will absolutely put the link to the Black Family Cancer Awareness Week webpage, making it easy for you all to download their social media kit. That means make a post, share some information about your experience with cancer, share some information about maybe a family member or someone that you know, and use the hashtag BlackFamCan. We want to spread awareness. We want to make sure that we're empowered, knowledgeable, and ready to be in the best position when it comes to battling this, I would say, pandemic of sorts that plagues so many people worldwide, but specifically focusing on our people of color. So thank you again for joining us, Dr. Luckson. I hope that you have a phenomenal week, a phenomenal day. Please continue the work that you do. We pray so many blessings your way. Thank you for taking this time. And to everyone listening, have a phenomenal week. Goodbye.
Bye-bye.